Hi, I'm Odali, and today I'll be talking about macronutrients. There are 4 essential macronutrients needed for our bodies to become in optimal health. One macronutrient needed is water. The second macronutrient is lipids. The third macronutrient is protein. And the fourth macronutrient is carbohydrates. Everyone needs a certain amount of healthy fats. And no, I'm not talking about cakes or desserts or sweets. I'm talking about tuna or salmon or avocados or nuts. It is important for your provider to order a physical every year so you can have a blood work for your lipid panels. The lipid panel consists of blood work that can check your levels of fats, phospholipids, and cholesterol. The fats that are in the test of the blood work are called triglycerides. And the other measurements for cholesterol are the HDL, which is the high density lipoprotein, and the LDL, which is the low density lipoprotein. The high density lipoprotein should be in the high levels, which is the good cholesterol. We need to make sure that this cholesterol is always high. The LDL, which is the low density lipoprotein, that level should always be in the low side. By being in the low side, which is the bad cholesterol, we need to make sure we have it in the low side for optimal health. And also we can avoid getting any cardiovascular disease or stroke. Also the triglycerides, which is also fat in the blood work and the levels, that should be in the low side, which it should definitely be able to lower the chances of you having any cardiovascular diseases also. A lipid panel test can be done to evaluate the risk of cardiovascular diseases like heart disease, heart attack, and stroke. Levels of total cholesterol should be around 200 milligrams. The HDL, which is the high density lipoprotein levels, should be around 60 milligrams or higher. And the LDL, which is the low density lipoprotein, that level should be around 100 milligrams or lower. Remember, the lower it is, the lower chances of having cardiovascular disease. The triglycerides should be around 150 milligrams or lower. Some levels may change depending on the person's health factor and the specific person. If a lipid profile is high, a person may have the hyperlipidemia, in which increases the chances of having or developing cardiovascular diseases. Also, high levels of LDL can cause a buildup of plaque in the arteries, which can result in arteriosclerosis. One of these tests are evaluated by your physician, and they can prescribe you medications to try to monitor and lower the levels and make recommendations for you to do to be able to do and increase your optimal health. To lower your cholesterol levels, there are some things you will need to change in your daily diet. And also, you will need to change the way you do certain things. For example, you do need to have a better food intake varieties and also integrate exercises in your daily day to do. Also, the recommendation would be to do at least 30 minutes of exercise every day so you can better the levels of triglycerides that are in your body. Also, watch the food intake. You got to watch what you eat and what you drink in order to minimize the advantages of having a better triglyceride. Also, if you're a person who likes to drink, the recommendation would be to stop completely or decrease the amount of drink that you're doing per day. Also, if you want to better your levels, you will need to also lose weight. That comes with the food intake and the exercise, but losing weight would definitely change the levels of the triglycerides and cholesterol. Eating foods like fruits, vegetables, nuts, that would be very good to do. That would definitely better your levels. Eating like fatty fish and stuff like that, that will definitely help with your levels also. Foods to avoid would be like saturated fats, trans fats, and excessive red meats. Certain meats are good. For example, lean meats are very good to eat, but not too much of the red meats. That would definitely make the triglycerides increase. I mean, doing these changes would definitely improve your overall health. So it would be definitely good to look into. There are many roles and types of lipids in body composition. Lipids are the body's way of storing energy and metabolism. It's triglycerides, which is a type of lipid that is stored in the adipose tissue. It utilizes the energy. Lipids are also cell membranes that regulate cellular structure for molecules to pass in and out of the cells. They also provide signaling, hormonal regulation, and insulation to maintain the body's temperature. Lipids do a great amount of absorption to help the body get proper vitamins. They also provide skin barrier functions by having our outer skin layer be made of lipids. All in all, lipids are a must and have a macronutrients for our bodies to have.